So fresh off the press, a nice review that was published from China on looking at vitamin D and immunotherapy agents in cancer and looking at survival. So hi, my name is Dr. Walter Lemo. I'm a naturopathic physician who has a practice solely focused in cancer care for over 20 years. So this study was actually released this month, September of 2025, and the title of the article is High Serum Vitamin D Concentration, so high levels, and supplementation, so taking vitamin D, were associated with improved survival outcomes and treatment responses in cancer patients receiving immunotherapy. A systematic review and meta-analysis. So in this paper, they were looking at the classic checkpoint inhibitors, such as like Keytruda, Opdivo types, but they were also looking at CAR T cell. They were also looking at solid mass tumors, like, so say, colon cancer, lung cancer, breast cancer, prostate cancer as examples. And they're looking at hematological, so like blood cancers, lymphomas. And so this is where the highlights were. Higher vitamin D was associated with a 53% lower mortality rate, so death rate, in cancer patients receiving immunotherapy. Vitamin D must serve as a predictor of prognosis and response in cancer patients. So basically looking at levels, high versus low. Higher levels, you could live longer, low implying that you could live shorter. Elevated vitamin D improved prognosis in lymphoma patients with monoclonal antibody. Vitamin D showed consistent benefits across cancer types and immunotherapy outcomes. They're looking at a broad base of cancers. Vitamin D supplementation prolonged overall survival in cancer patients treated with immunotherapy. So really interesting findings thus far. And then we're looking at the discussions and conclusions here. Our study indicated that vitamin D was positively correlated with multiple survival outcomes and treatment responses in solid and non-solid cancer patients, so the hematological cancers, receiving different kinds of immunotherapy. So basically, it's kind of what it signifies is that if your immune system is properly supported, no matter what kind of agent you're using, it could potentially make it work better. It's not rocket science to naturopathic doctors, that area. Higher vitamin D concentration was associated with improved overall survival amongst lymphoma patients receiving any immunotherapy and a monoclonal antibody based only. Therefore, we call for surveillance and monitoring of vitamin D concentrations before and during immunotherapy in cancer patients. So, and yes, they also said more design trials, are required, but so imagine that. So they're saying vitamin D levels should be checked before and during treatment. How often are patients being checked for vitamin D levels in cancer with immunotherapy? Here in British Columbia, that is definitely not a standard. So anyways, interesting findings. Again, China once again is really leading the way and looking at these more simpler, more vitamin nutritional based approaches. Not surprised coming from China, where I tend to find they're not so polarized in that area. They're doing lots of great research with drug development, oncology drugs, and they're also looking at things in the natural medicine arena as well. And so good on them for looking at this. So obviously, as the author had said, more research and prospective trials are required, but this is definitely being put on the map once again on vitamin D with immunotherapy and improved outcomes in patients with cancer, both solid mass tumors and hematological blood cancers as well.